Thank you very much, Presiding Officer. According to the Scottish Government, 23 babies required the use of the neonatal unit at University Hospital Wishaw last year. That's 23 babies born extremely prematurely at less than 27 weeks gestation or who have low birth weight and require intensive care support. At the Sick Kids in Glasgow, there were 27 babies, in Edinburgh there were 33, and in Aberdeen there were 18. The Scottish Government, in their wisdom, have decided that neonatal services need to be reorganised, moving from the existing number of centres down to 3 and closing the units at Ninewells in Dundee, at the Victoria Hospital in Fife and at Wishaw. I want to focus my remarks on Wishaw, because the unit at Wishaw is an award-winning service in Scotland's third largest health board, serving a significant population of our country. It just makes no sense to close it, and it is vehemently opposed by parents and clinicians. And today, I and the Scottish Labour Party add our voices to theirs. The appraisal report on which ministers have taken their decision is seriously flawed. In a devastating briefing to MSPs, the government's approach is exposed. There was no consideration given to population deprivation factors in the areas served. No consideration given to the lack of transport links for families. No consideration given to the inequality caused. No consideration given to the displacement of families from their community networks that sustain them. No wonder there is a 12,000-strong petition opposing the move started by Lynn McRitchie. Lynn's own son, Innes, now aged 4, was born in Wishaw, and she is concerned about the level of stress and trauma that having to move extremely premature babies would cause families at a time when they are already extremely vulnerable. The view from clinicians and senior staff members is equally stark. The data on which decisions were taken is incomplete. There was no up-to-date evidence base used. No outcome data will be available as there is no measurement of baseline. How on earth can you tell if this model will work if you don't have that information? Now, the Scottish Government is keen on saying it listens to experts. It's keen on saying it's all about evidence-based policy making, but just not when it applies to neonatal units, including the one in University Hospital Wishaw. If the Minister has evidence, then publish it. If she is so sure of her ground, then meet with the clinicians at all of the units you intend to close. Meet with the parents too. And there is more. NHS Lanarkshire were not represented on the working group at all. The other health boards were. There has been no consultation with stakeholders, no consultation with the staff at the neonatal unit, no consultation with families, and there is no sign of a government consultation after they have made their decision either. Now, as far as I recall, the NHS, the Scottish Government, are supposed to consult on major service changes. Or do the rules not apply when it comes to the SNP? Parents will tell you that staff at University Hospital Wishaw are highly skilled and well trained. The specialist neonatal team, including consultants, nurses, midwives, allied health professionals such as pharmacists, dietitians, OTs, they are all literally lifesavers. How could you not speak to them? I am completely baffled by the tone-deaf approach of the Scottish Government. This has had a profound impact on staff well-being. Nursing students seeking a career in Wishaw have pulled out their applications, and we know that there will be an impact on maternity services too. Now, I know the wider question of maternity services is being explored in a later debate led by Megan Gallagher, and colleagues are right to point out the lack of consultant-led maternity services in Elgin, promised by the Scottish Government, but with no plan for recruitment or delivery. Let me turn to another aspect of the neonatal decision, and that is levels of staffing. Statistics from the National Neonatal Audit have a very interesting story to tell about the coverage of nursing shifts. Comparing statistics in Q2 of 2023, which are the latest statistics available, In Glasgow, the coverage for nursing shifts in neonatal was 65%. In Edinburgh, the same coverage was 56%. In Wishaw, the coverage was 91%. Yes, that's 91% of shifts covered. Consistently, the best performing neonatal unit in terms of staff coverage. So what I want to know is, why are the Scottish Government closing the unit with good levels of staffing, which we know matters in securing good outcomes for babies? Neonatal staff, nursing staff in the sick kids tell me that they can barely cope with what they are doing just now, with the numbers of sick babies they are having to care for, without adding even more sick babies to their care. Jackie Lambert of the Royal College of Midwives said, "The best interest of the baby and parents must always be the focus of any service changes, but it is essential that these 3 units have the capacity for all the babies that will need care and accommodation for the mothers." Presiding Officer, the Scottish Government would do well to heed those words and the views of expert clinicians and nurses and families. The survival of some babies will be put at risk by this decision, and the Minister must listen and reverse it. Today, SNP MSPs have a chance to pick what side they're on, the side of families and clinicians or the side of their party bosses. I know whose side I'm on. I move the motion in my name.
Thank you, Ms Baillie. I now